السلام عليكم ورحمة الله وبركاته. زملائنا الطلاب والطالبات في كلية الصيدلة جامعة الموصل المرحلة الثانية. أنا زميلكم الطالب عمر يونس عيسى. اليوم راح أتقدم إن شاء الله بسمنر توضيحي مبسط عن موضوع الإبليبسي اللي هو الصرع. راح ناخذ مقدمات عن هذا المرض، مسببات هذا المرض، وأنواع هذا المرض، وإن شاء الله راح ناخذ بالأخير طرق علاج هذا المرض. نبدأ إن شاء الله بمقدمة حول هذا المرض. Introduction. Epilepsy is a central nervous system neurological disorder in which brain activity becomes abnormal that can causing seizures or a period of unusual behavior and sensation and sometimes loss of awarenesses. Anyone can develop epilepsy. Epilepsy affects both males and females of all races, ethnic background and ages. Symptoms. Because epilepsy is caused by abnormal activity in the brain, seizures can affect any process your brain coordinates. Seizure signals and symptoms may include: number 1, temporary confusion, and number 2, a stirring spell, and number 3, uncontrollable jerking movements of the arms and legs, and number 4, stiff muscles. Vocal seizures. When seizures appear to result from abnormal activity in just one area of your brain, they are called vocal seizures. These seizures fall into two categories. Number 1, focal seizures without loss of consciousness, once called simple partial seizures. These seizures do not cause a loss of consciousness. But number 2 is focal seizures with impaired awareness, once called complex partial seizures. These seizures involve a change or loss of consciousness or awareness. Types of epilepsy. There are 4 different types of epilepsy, are defined by the types of seizures a person experiences. These types can include: number 1, generalized epilepsy. Generalized epilepsy can infection of all parts of the brain, but number 2, focal epilepsy can affected on special part of the brain, and type 3 is combined generalized and focal epilepsy, and type 4 unknown epilepsy. Seizure types. In picture number 1 is about 60% of people with epilepsy have focal seizures, and in picture 2 about 30% of people with epilepsy generalized seizures, and about 10% of seizures have an unknown onset. Cause of epilepsy. Epilepsy has no identifiable causes in nature, and in about half the people with the condition, in the other half, the condition may be traced to various factors included, and this factor can include genetic influence and head trauma and brain abnormalities, and sometimes infections and prenatal injury. Risk factors. There are different types of factors may increase the infection with this disease. Certain factors may increase your risk of epilepsy. This risk can include number 1, age the onset of epilepsy is most common in children and older adults, but the condition can occur at any age. Risk factor number 3. Number 2, family history. If you have a family history of epilepsy, you may be at an increased risk of developing a seizures disorder. And sometimes head injuries. Head injuries are responsible for some cases of epilepsy. And factor number 4, stroke also can increase the infection in epilepsy and other vascular disease. Stroke and other blood vessels vascular disease can lead to brain damage that may trigger epilepsy. Diagnosis of this disease. To diagnose the epilepsy, most your condition and your doctor will review your symptoms and medical history. Your doctor may order several tests to diagnose epilepsy and to determine the cause of seizures. Your evaluation may include number 1, a neurological exam, and number 2, a blood test. Treatment. Most people with epilepsy can become seizures free by taking one anti-seizure medication, which is also called anti-epileptic medications. There are more than 20 different types of anti-seizures medications available. The medication that your doctor chooses to treat your epilepsy depends on the type of seizures you have, as well as other factors such as your age and other health condition. And a treatment that uses in this disease can include lamotrigine and phenobarbital and valproic acid and gabapentin and other types of treatment can used to treatment of epilepsy. واخيرا ان شاء الله نكون وفينا بشرح الابيليبسي، ونشكركم لحسن الاصغاء، وان شاء الله ينال اعجابكم.